Hi there guys, my name is Monica Wojcik and I'm here today to talk to you about the weight loss method of reducing calories, specifically reduced calorie diets and calorie counting. The title of this presentation is Calorie Counting and Reduced Calorie Diets, Weight Loss Method. Before we begin, I want to give you guys an idea of what this presentation will entail. First, I will give an introduction of the current obesity epidemic. Secondly, I will inform you on the rationale of this method. Then I will discuss what low-calorie versus very low-calorie diets are. I will discuss a research finding about this weight loss method. After this, I will discuss what calorie counting is, and I will provide a research study on calorie counting. After this, I will provide information on possible barriers, and lastly, I will talk about what to take away from this presentation. To begin, I will discuss the importance of weight loss strategies, specifically the current obesity epidemic. It is important to note the current prevalence of obesity. About 39% of adults ages 18 and over are overweight. This has tripled from 1975 to 2016. It's important to note this because obesity can cause other problems such as a higher blood pressure, atherosclerosis, which is a buildup of fat on artery walls, heart disease, and a higher risk of other health complications. The infographic provided on the slide provides information on how we classify weight with BMI. So BMI is the body mass index. Next, I will discuss the rationale of this weight loss method. So how does this method lead to weight loss? Basically, the reduction of 500 calories per day leads to half kilogram weight loss per week. So in order to reduce the calories, we must first determine one's caloric needs. One method to do this is the Harris-Benedict equation, specifically the BMR formula. So BMR stands for the basal metabolic rate, which is the number of calories required to keep the body functioning at rest. Now I will discuss about two different reduced calorie diets, the low calorie diet and very low calorie diet. So for the very low calorie diet, this is restricted to less than 800 calories per day. It consists of 55 to 60% of calories from carbs and less than 30% of calories from fat. The diet is 4 to 8 weeks, followed by traditional low-calorie diets. It has shown to have a rapid mean weight loss of greater than 10% in 2 to 8 weeks. However, there are negative outcomes noted, such as electrolyte imbalances, hypotension, which is a lower blood pressure, and gallstones. It's important to note that this diet needs to be supervised by a healthcare professional. So next we have the low-calorie diets. So this one's restricted to 800 to 1500 calories per day. This one has the same percentage of carbs and fat. However, there's an emphasis on low glycemic foods. So low glycemic foods are ones that have less impact on blood sugar levels. For example, choosing whole grains versus refined grains. And lastly, this one had a mean weight loss of 10% in 3 to 12 months. So what does the research say? It's important to discuss what research has shown, and I will explain one study done with this weight loss method. This study had a design of observational cohort. So there was 9,037 participants, ages 48 plus or minus 12 years. So most of these were women, and then only 17% were men. And the classifications of weight are listed below, and most of these participants were overweight or obese. So the method was 3-month weight loss phase, including a very low-calorie diet, low-calorie diet, or restricted normal food diet, followed by a 9-month weight maintenance phase. The results showed that the very low-calorie diet had the most weight loss, followed by the low-calorie diet, and lastly, followed by the restricted normal food diet. Now I will focus on reduction of calories by the calorie counting method. What is calorie counting? So calorie counting is monitoring one's caloric intake per day. So the idea behind this is that the counting process provides self-regulation, which leads to behavior change, so healthy behaviors. However, there are possible dangers of techorexia, which is when health technology causes a normalized compulsive disorder. Now I will go over a study that has been conducted with a calorie counting intervention. This design was a randomized controlled trial including 212 participants of ages 18 years or older and a BMI of 25 or more, and they were smartphone users. So the methods were either 6 months of usual care or 6 months of using the MyFitnessPal application for calorie counting. The results showed no significant differences in weight loss between the two groups. However, the intervention group was found to have a higher use of a caloric goal. And it is important to note that a possible limitation to this study is the lack of readiness of the participants. Now I will discuss possible barriers for counting calories. So this would include obsessive behaviors. So participants noted that they had an obsession with counting the calories. They also noted a loss of enjoyment of eating due to the obsessive thinking about the caloric restriction. In addition, those participants found that the applications were impersonal. Having a focus on counting was not personal to the participant. And lastly, there were notes of the application to be too much work, specifically too much input to have on the application. Lastly, what to take away from this presentation. So reduced calorie diets and calorie counting are potential weight loss methods. However, more studies need to be done in regards to the effectiveness of these weight loss methods. So as we went over the studies, we found that there were inconsistent findings. It is also important to know to consult your doctor or physician before starting any type of diet restriction. And lastly, the studies found that the calorie counting method was not effective in weight loss. However, it was effective in making caloric goals. It's important to note that the limitation of these studies includes the lack of readiness and motivation of the participants. These are my references. Thank you so much for watching.